Hi there, I'm Amanda West, and I decided to do my project on the cardiovascular system. So my first article focuses on atrial septal defect. It's a congenital cardiac disorder, and it's caused by malformation of the internal septum. So that means there's one or more holes in the heart going left to right. So many individuals can live their entire lives with small ASCs unaware of the existing abnormality. The most common symptoms, dyspnea upon exertion, and this doesn't normally occur to you in your 20s or 30s. Most cases aren't even diagnosed until you're in your 50s, and it occurs more often in females than in males, ratio 2:1. ASCs produce a left to right shunt, so oxygen-rich blood from the left atrium mixes with oxygen-poor blood from the right atrium. If it's not treated, it can cause hypertension, heart failure, atrial fibrillation, and stroke. So most ASCs eventually require fixing, but depending on the size and if you're having complications or not, it might not need to be fixed. If you do have to have surgery, though, it's best to have it before you're 25 years old, which is inconvenient because you don't normally find out till after you're 25 years old. But depending on how large it is and the risks you have, you can have it be repaired. So a fun fact is ASD is not common, but it's the most common congenital cardiac anomaly that usually is asymptomatic until adulthood. So my next article focuses on the different types. So there's ostium secundum atrial septal defect, and this is the most common. The middle portion of the atrial septum fails to close during fetal development. The next is ostium premium atrial septal defect, and it's less common, and it's where the lower part of the atrial septum fails to develop normally, leaving an opening between the atria. And the least common is sinus venous, and that's where there's an opening in the upper portion of the atrial septum, and it's often associated with malformation of the veins from lungs to heart, so the pulmonary veins, or the vein that returns blood from the body, the vena cava. So approximately 1% of infants in the United States are born with a form of congenital heart defect, and 10% of these are atrial septal defects. So a fun fact is a related disorder to this is in the group of common congenital heart defects, and this is an absence of one ventricle. So there's two atrias and one ventricle, and this is the ventricle septal defects. My last article is about Tricuspid Atresia, and this one's pretty crazy. It's a heart disease that presents at birth, and it's where your tricuspid heart valve is missing or abnormally developed, blocking blood from the right atrium to the right ventricle. So it's a very uncommon heart disease, and because blood can't flow from the right atrium to the right ventricle, blood can't enter the lungs to pick up oxygen. So instead it passes through a hole between the right atrium and the left atrium and mixes with O2-rich blood from the lungs. So now there's O2-rich, O2-poor blood. It's mixed. It's pumped to the body from the left ventricle, causing all your oxygen levels in your body to be lower than normal. So if you're born with tricuspid atresia, your lungs receive blood either through a hole between the right and left ventricles or through a fetal vessel that you have when you're a fetus, and it's called the ductus arteriosus. And this connects your pulmonary artery, it goes to your lungs, to the aorta. It's present when you're born, but then it normally closes up after birth. So this disorder can be detected during prenatal ultrasound or the examination right after birth. So some signs and symptoms are heart murmur, bluish skin at birth. Treatment is generally going to require surgery. Can happen within a few days of the baby being born. So an artificial shunt is put in to keep blood flowing to the lungs. Then if that goes well, 4 to 6 months old. Half of the veins that carry O2 poor blood from the upper half of the body will be routed directly to the pulmonary artery. Then a little while later, another surgery is performed, and that is when the rest of your veins carrying O2 poor blood get connected in to your pulmonary artery. So now your left ventricle only has to pump blood to your body, to your lungs. And so that's 3 surgeries. And then after that, you will no longer have blue skin. But a fun fact of that is 5 in 100,000 live births have this, and 1 in 5 of those will have other heart problems. So I chose these facts because my aunt was recently diagnosed with ASD, and she's in her late 50s, not in the best shape of her life, and the doctor suggested fixing the shunt would better her daily life and would help her out. But after she actually had the surgery, everything got worse, and now she has just got diagnosed with congenital heart failure, COPD, has really bad edema, is on a bunch of diuretics, so it's kind of funny that it didn't work. But I was curious about the disease. So thanks for watching my video. Hope you learned a lot. Any questions, I'll try to answer them. Have a good day.